Ano?
मुझे भी चाय देना.
Kindly mute your mics. Assalamu alaikum. Assalamu alaikum. My name is Mariam Tariq and I am in second year MBBS student from Aziz Fatma Medical and Dental College, Faisalabad, and I am an ambassador from Punjab on the behalf of Excemy Medical. And I welcome you all on the behalf of Excemy Medical in this seminar. It's been a long time, but we are here again with an amazing seminar. And I hope this will prove beneficial and will solve all the queries in your mind about USMLE exam. I want to inform you about a thing that you can always drop your questions or queries related to the session in the WhatsApp group or in the comment section on the Facebook. Secondly, I want you all to follow our Instagram, Facebook, and YouTube, so you will be staying updated about our next sessions. So without making any further delay, let's dive into our session. I want to introduce you all to our speaker, Dr. Hamza Farooq from Galveston, Texas. So over to you, Dr. Hamza.
Hello, everybody. Assalamu alaikum and good morning. I hope, well, it's morning for me and probably night for you, but you know what it is. It's been a long time, but I thought I would do something different here today. And instead of having a presentation for you, I would make sure that we would make this presentation together. Now, don't worry, it's no hard work for you, more for me. So let me share something for you. What do people most commonly ask about the USMLE exam? Because that's on everybody's Oh, thank you for that. That's on everybody's mind. The USMLE. What do we do? How do we start? It's not easy. It's a big step ahead. So let me first introduce you to a screen I made. Not my usual platform, but let's see here. Okay. Let me bring this up. Give me a second. I want you guys to come up with any questions you have for me today. I am an open book for you guys. And hopefully the information I give you guys will be helpful for you so you can pass it on later on in your careers when you become even more successful doctors. That's right. I mentioned that. All right, let's share this now. Back on it. Okay, let's see. It's gonna come up in any moment. Can everybody see this screen? All right, let's bring this up first. Welcome to taking your first step. All right. So what is the first step? What should we really do, right? This isn't coming out right. Give me a second. Things are not working out today. It's an early morning, but we'll get there. Don't worry, I got you guys covered. Okay, this should be it. All right, can everybody see the screen? Everybody's there? All right, welcome to taking your first step. So like I said, we'll be making the presentation together. So what's the first thing on everybody's mind? Can anyone guess? It is the ECFMG portal. How do we register for that? It's simple. All right, ECFMG, if you go onto their website, obviously a lot has changed from the last time I took the exam. And one of those things is that if I can bring this up here, which I will see, there's a whole lot of screen documents that need to be there. Okay, let's do this here. Let's bring you up to this speed. Let me show you guys this website, the ECFMG portal, right? All I'm gonna type is what? ECFMG, that's it. Right here, you click here. Where does that take you? This whole platform has changed because they went through a maintenance process. But if you go to online services, right? And what are you? You're not a, well, yes, you are basically. You're looking for this basically. Underneath physicians, you're looking for interactive web applications, IWA. Now, if you click that, I have all my information on here already, which is there. But once you're in, you're going to register for a USMLE ID identification number. I would normally recommend doing this in like, you know, before you take the exam, before you're even thinking about it, if you can get it done even in the previous year, this should be your first step. All right. You log in, you make an account, they give you a USMLE ID number. There's a couple of forms. I think one was form I-80. You have to get it notarized, obviously. Once it's notarized, it has a small fee. I think back in that day, it was like $150, but I think they've brought it less now. Once you've notarized that, they will send you your USMLE ID number. And when you have the USMLE identification number and the password, you're good to go. After that, it's no big deal. All right. Obviously, you will have to listen to like getting all your paperwork is the most stressful thing you can do because you have to get it done in a certain time frame. And I would recommend doing that maybe in 6 months advance because getting all those documentations from your respected university that you're in, whatever university that you're in, it will take some time, all right? Does everyone understand this so far? This is the very first step that you need to think about before you're even taking the step exams, because if it is delayed and you want to take your exam soon too, anything could happen in that time period where they might, like if you're a graduate, they might delay your degree. Or if you're in medical school and you're taking your step one, all right, then you might get some time, like they might give you more time into where you might not get it just in time to take the exam and to apply for it. But once you have the documentation in, after that, all you have to do is just pick your 3 months that you want to apply for the exam. I would recommend first, unless you're ready and you know the time frame of those 3 months that you're going to take the exam, don't pick those dates yet. The 3 months are the months that they give you. So like I'm thinking about if I want to take it in February, right? I'm going to pick January, February, and March. So I have a time period where if I want to take it earlier, I can take it in January. Or if I want to delay my exam, I'm able to take it in March. But it's all stressful stuff, but you get through it. It's no worries. The other thing that I did want to mention that is very highly yield and that is important is after you've selected those 3 months, then it's like game time. You know, before that, make sure the proper step of taking USMLE Step 1 is I tell this to everyone because I have taught students in the previous year about the step exams, and that is, it's important to take a diagnostic exam. It's okay if you fail. Everyone fails, you know. No one does good on their first try. Take a diagnostic exam, see where it is, see what your actual score is, how much knowledge have you retained. All right. A diagnostic exam is just going to tell you your strong suit and your weak suit. All right. Your weak suit on how much you can improve from what you're lacking in and how much you can go. And I will later tell you where you can get those diagnostic exams done as well. But now that we've talked about ECFMG, let's go over to, there are multiple screens right now. I'm sure you guys don't have that problem, but everything is everywhere right now. All right, once you've taken, let's talk about the actual USMLE Step 1 exam. What is it? USMLE Step 1. I would love to hear your guys' opinion. What is the Step 1 exam? You guys can comment down below. Yeah, you can register anytime. There is, if you've registered and you're delaying an exam, then obviously like you've picked your date, you've paid money to take that exam, and then you want to give some time, like, you know, later delay it, and it's past those 3 months, then yes, you would have to pay the extra fees on there. Most dreadful exam. You're not wrong, Mona. That was an interesting comment. It doesn't have to be. Step 1, what it is, it's basically an understanding of your basic concepts. You know, a lot of people make this misconception is that you need to memorize everything. You don't need to memorize everything. You just need to understand the concept. Understanding the concept is not easy, but if you understand step 1, even though it is a pass and fail now, then you will get to the point where in step 2, if you have a high knowledge retainance in step 1, then it's going to help you along with step 2. All right. About now, a lot has changed, obviously. And step 1 is basically what is the ideal time for step 1? I would say literally you can take it after your third year, right? You can even take it after you graduate. All right, the only time frame you should worry about is residency, because they will ask you about, like, if you're having a gap year and you're not doing anything, they will ask you, what are you doing after you graduated, along with taking that step 1 exam. That's an extra thing, but we will talk about that more later in this session. And about 2020 2024, I think it would be a great idea that if you're able to take the step one exam, then yes, because the new policy about 2024 has changed. And that is because in my time, like there were scores and now it's become pass or fails. And now there is a certain rumor going on that step two from doctors. It's not official yet, but and it's not official from me. You guys didn't hear this from me as well, but a rumor is going on that step two may eventually become pass or fail now, because that was the original method that they were trying to do for US residency. But besides that point is that if you are, I would say do not take it if you're not ready. If you're ready, if you've done the proper steps and the proper, phases of taking the step one exam, that's when you should take it. And I'll tell you how to do that step by step. We have a lot of time on our hands. Obviously, I do too. It's my off day. So that's why I'm sitting here. So if we do a non-training job, would that be counted as gap? No, anything medical related, it fills in your gap. You could be a medical scribe during your gap year. You could be helping a doctor out on rotations during your gap year. All that counts while you're taking your step one exam, as long as you don't have a gap year of more than, I'd say, 2 years, and you're able to cover whatever you're doing after you graduate, then you're good. I wouldn't worry about that. The pass or fail criteria of the process is, in your opinion, the pass or fail criteria is making the process easy or more competitive. I would say for some people that are taking the exam, it is not easy because the questions are changing, and they will be changing by the time you guys take the step one exam. And I would say now it is more competitive, because before for IMGs, what was the barrier? It was the step one exam, right? It was the step two after. Now that barrier has been broken. Now that residency, what they're looking for is that step two CK score. Even CS is not available currently now. That's what they're looking at. If you're pass or you passed in step one, let's say, right? You need that high step two score exam to get it done. But how are you going to get that step two CK score? Is knowing your understanding and knowledge of the step one. All right. Is everyone following me here? Am I making sense? If not, then stop me. No worries. Yeah, I'm trying to look at comments on Facebook and Instagram and in our Zoom session as well. So no worries, I will get to each and every one single of you, but let's move on ahead. Let's talk about the actual step one exam. All right. So like I said, the step one is basically, it assesses it on your understanding and ability, right? To apply the important core concepts. All right. What are the main subjects of the step one exam? All right. I will get to the 2024 policy. I just want to go through this first as well. What are the main subjects of the step one exam? All right. You have anatomy, you have physiology, you have biochem, you have pharmacology, you have pathology, you have microbiology. Behavioral science is an important one. People disregard that, but it is important. And now the new book, I believe it has something about like nutrition, genetics. Genetics was always there, but now they have more questions on that. Aging ethics is important. And there's like this whole extra session, but like if you learn those and even in like you get 2 of those, 3 of those, right? It's extra points for you, right? You can't get through that, right? So the main contents covered, right? What is the most common contents that will show up, right? You have your general principles, right? Around 25 to 35% of that comes in the exam itself. But you also have something like, it goes into your individual organ systems as well, right? you have, let's say you have something about the skill in connective tissue, gastroenterology, renal and urology, all these questions will be mixed up. And that is why it is important. It is very important to practice questions as long as like with your study period as well. All right. And most common, I would say to use as a resource is UWorld. I know it is a lot of money getting that 6 month or 1 year package of UWorld with the self-assessment test. I know in Pakistan, you could get questions off of that off the bat, really. But UWorld is important. I would recommend take the subscription because it's an AI platform. Actually, it will monitor how well you're doing, what resources are doing, and as long as you practice those questions, let's say I'm sitting down, I used to first take 20 questions a day, right? Before that I used to take 10 questions a day. Eventually I had to move myself up to 40 questions a day, and why did I do that? Because as long as the questions were, coming through, because some of those questions will be repeated and it's okay, but the next time the question shows up or something similar to that question, then you will be like, oh, I know this. I got this. Like it immediately pops up into your head like a single keyword. That's how your brain works. And that's fascinating. A single keyword, and you'll be like, oh, this is the option. That's it. That's how I'm picking, and I'm correct on that, right? And after that, when to get the subscription from start. So you would like, are you Sana, are you talking about what year you should get the subscription? Whenever you're planning on taking the step one. Um, let's say you want to take the step one in, I don't know, 6 months. By the way, it's pass or fail. I would not recommend to someone taking a step one a year in advance. You know, I would recommend, since it's pass or fail, because what is a passing number? It's like 195, I believe, 196, something like that. Uh, I forget. It's been a while for me. But even though if you score 200, you pass, and honestly, it's not that hard to score that. I mean, eventually you will move up to your grade, but like the ideal timeline to take the step one, if you really want to study, is I would say 6 months. 6 months is great. If you're in your third year, take it. 6 months is really great. Did I join any study groups online? Actually, I did. The most, because people will judge for this, but it's also how you retain information. I found Kaplan to be very useful at its time, right? I met a couple of great professors in pathology and biochemistry, and they helped me understand the smaller concepts of life. Because when I studied in Pakistan, when I studied in a certain university, the thing was that professors would come and the most common thing in Pakistan is professors would come and just read from the slides, presentations, and it'd be hard to get an answer out of it. And kuch to bolte ke Allah ki marzi hai, and I'm like, yeah, Allah ki marzi hai, but there has to be a reason behind it, right? There has to be some concept behind it. Where there's a clinical, there's a basic behind it. And I later found that out when I went through Kaplan, and they helped me understand the basic concepts of it. They helped make connections, even how pathology connected with anatomy, connected with biochemistry, small connections, and these things click in your head. All right. And I realized my video's been stuck, but hopefully my voice is going on, which is great. The other thing is that Kaplan was the number one resource, and later I found myself into be in their study groups, and I met people from Egypt, Cairo, I met people from all the way around the world that were taking their step exams, and it was kind of an interesting experience. But because of that group, a lot of people were posting questions, and a lot of people were just like, oh, how do you solve this? And there would be one person that would help you in that. And they were like ages were like from all over, you know, like, so you have some people that were in their 20s, in their 30s. I had someone in their 35s, you know, but it was exciting. Normally Facebook groups of Kaplan are pretty nice. You get an invitation once you sign up. There's a lot of USMLE forums that you can get into. There's a lot of people studying, but the most important group is like find a couple of friends, join a group with them. If they're taking a step one exam and if you're taking a step one exam, why don't you study together? Why not get it over with, you know? So I did choose Kaplan, and boards and beyond when I took the exam was fairly new, but I did go over the concept of boards and beyond, and I did like it though. Boards and beyond is very useful if you guys don't understand Kaplan, because boards and beyond, what it does, it goes through the first aid book, right? So the video lectures are exactly how it will go through the first aid, and it understands your concepts amazing too. Again, it depends on what works better for you, you know? For me, obviously, Kaplan did great. Boards and beyond, I did a little bit of it. And both of them helped me, you know? And that was great for me. I think yeah, have a friend. Study buddy in preparation is very good. A lot of people ask me this because when you're studying by yourself, you will feel a kind of depression, you will feel kind of loneliness, you will feel somewhat down a bit, where you just get away from friends, you lock yourself in a room, you start studying. It's normal. With a study buddy, you know, you guys will coordinate questions with each other. Obviously, don't find a bad study buddy. Like if they're distracting you half the time, what's the point of, you know, preparing for the step one exam? That shouldn't be it, right? Find someone who's at that, you know, they're motivated to take the step one, you're motivated to take the step one. That's great for you. All right. When to start studying if you have to give USMLE in fourth year along with MBBS studies? I would say if you're in fourth year, take 6 months. I know fourth year have major exams coming in, like with ENT, eye ophthalmology, and a lot of clinical exams that they have to take along with ward exams. I would say, you know, if you can even take your step one in final year or right after you graduate. No big deal, as long as you can cover up that gap, you know. But ideal time could be to take it at the end of fourth year, which is really great because then, excuse me, you get it out of the way. And then all you have to worry about is the step two CK. Again, like I said, step one is pass or fail. So do not spend too much time off it, but enough time where you're just understanding the concepts, if that makes sense. So IELTS, all right. It's an English language proficiency exam. I did not have to take it, but I know now it has been required for IMGs to take it, especially if you're taking the step one exam, because they have different pathways now, which is going into the 2024 policy for the USMLE. But the thing about IELTS is it's not hard, honestly. With IELTS, there's a lot of practice centers in Pakistan, but all you have to do is just take those practice exams for IELTS too, really. Obviously for me, I grew up here in Oregon, in Dallas, you know, so English was not my major concern growing up, but I know as an IMG it can be because they ask about grammar stuff. And even when I took English classes in America, grammar was just weird to me in the beginning, you know. So that's an interesting question about taking IELTS before step one. But let me say here what the new rule for the 2024 is, because I had it come up from another doctor. He's also a resident here. And he did not have to take it as well, but he knew someone that did. So let me read this to you, right? Individuals applying for the ECFMG certification must be a student or graduate that is appropriately accredited, right? Which is okay. The school must be appropriately accredited, which was in the past now too. Only students from accredited schools will be allowed to apply for the ECFMG certification in 2024. Making sure your university is properly has their documentation in and are with the ECFMG portal as well, right? But the thing that people are concerned about, because this is with Caribbean schools as well, a lot of Caribbean schools are not being accredited anymore, so they have to take the exam before this rule comes into place. Which for me it is weird because it was there before, but it wasn't just emphasized, you know. The other thing about that thing is it is important to understand how your decision and choice of medical school today may impact you in the future. The basic science part of the program usually lasts 20 months. All that 2024 to me of the policy, all it's saying is that make sure that the university you're in is properly accredited. It's with ECFMG, it's taking over those, there's a certain amount of like um a course that a certain medical university has to go to, you know. That is true. So with the visa nowadays, you do have to take your IELTS with the USMLE, and if it's not there, then a visa may be an issue because any university, not even for medical, like any university in the US, they were taking IELTS before. They had international medical students come in, and the only way they could classify them is how they scored on their IELTS, you know. But now let's go towards, I'm gonna answer everybody's questions, don't worry, but I just want to finish all this visa and 2024 policy that they are coming up with over here. So back to that original question, I know someone did ask me that should I take the USMLE before the 2024 policy? I would say you don't really have anything to worry about if it's already accredited and you don't think it's going away. I heard some rumors in Pakistan that a lot of universities won't be accredited anymore. And if that is the concern, then yeah, definitely take the USMLE exam before, because once you take the USMLE exam, you're in the system. They will recognize that you've already taken it by the time it's there. But you have to make sure you take the step 1 and then after that closely with the step 2 so you can get that ECFMG certification, which is important before you apply for residency, or at the time you go for interviews. One of those things. Green card, having a green card does not affect the USMLE at all, because listen, the USMLE step 1 is fair to all the students. It is only now pass and fail that is being the problem, because now they are they used to give more seats here to the American medical graduates, but now like if you pass to step 1 and if you still can get a high score on step 2 CK, then yeah, they will accept you. And having research does help as well, but do not waste your time on doing research and the step exams. I would recommend having research towards the end. You are going to get a lot of time. That time period, maybe do one research already if you're not taking the step exam, but when you're studying, make sure your whole focus is on the step 1 and step 2 CK. After you graduate, after you've taken the exam and during that time period of residency, you have a lot of time to do rotations. You can fit in, you can work with a doctor for research, and the best way to reach out for research is, let me tell you, a lot of these programs will ask you to pay. Just email email the doctor. They have their numbers listed, right? They have their emails listed. Call the hospital if you can, talk to them directly. This rotation I had at in Houston at Baylor St. Luke's, all I did was like you know, I was in Houston at that time, and I went to the hospital and I talked to him. I didn't go to any like weird, like, a platform where they could give me residency. I know it's hard for IMGs, but you could always email them. You could always talk to them. But if that does not work for you, then yeah, obviously, um, try not to pay too much, because medical itself is a lot of fees, but I guess you can get a rotation around $1,200 or something, but I would recommend just reaching out to doctors. That's all there is. So like I said, you don't have to take IELTS before step one. You could also take step one and then you could take the IELTS. There is no reason, but if you want to get it out of the way, then yeah, take the IELTS and then take step one. They have no correlation with each other. It's just these are things off your check mark that you just need to get done. A lot of electives. This is important, actually. This is a very good question. A lot of electives for step one, they do require step one. Like if you want to apply for, like, let's say a general surgery rotation, then yeah, they will want your step one score. There are just, high universities, like prestigious university hospitals, that will require step one, but a lot of hospitals don't require a step one score. They will get you that, and that you would have to research yourself. There is a list that I can write down here, and it, later on, and it gives you a lot of university hospitals. It gives you like what they're requiring. You can also go to those university hospitals website as well, but the best way to apply for electives is also reaching out. Email those doctors like crazy. A lot of them will just take you in for that. You don't have to apply for portals. This is just a thing that they do now. Like I said, they are very expensive, and another option I would have is that they do have very cheap programs as well, 4-week electives, and they will apply, like, give you, but most of that, goes into housing and everything. What I did for rotations personally is that I would find housing on, I would not, use them for housing because I would be spending too much money with them, whatever that was, but I would literally, go to Facebook Marketplace, or like I'm talking about like my fun era, I guess. Go to my go to Facebook Marketplace, look up housing. I would room with like 4 people in one, and they were all medical professionals, so it was okay. It was nice. I roomed with 3 people in Houston, actually. And from there, what happened is that I did the rotation. It wasn't that bad of a drive. I did have a car though, so that was very helpful. But they do have transportation where you just have to, pay for like a TriMed pass or something, and they are very cheap. But reach out to the doctors, email them. Maybe you'll get an elective for free. Who knows? Maybe the doctors will be interested. You got to show you have interest in that field, and make sure your elective that you're doing is like, if you're applying for an internal medicine residency down the phase, if you're applying for a general surgery residency, make sure you have an elective related to that. It's very important. Yes. So I know a lot of you do electives in Pakistan, and that is great. It is an icing on a topping, or cherry, on a cake. But the thing is, it they do unfortunately look for electives here in the US. It is important to look for that, because they want to see how well you can adjust to the system over here. Personally, now that I'm going to the hospitals, and now the system that they use here is, if you're working in a clinic, it's called eClinicalWorks, And if you're working in a hospital, it's called Epic and it's all computerized. It's very easy to operate, but it does take time getting used to going through the chart reviews, progress notes, consult notes. You know, if you have a coronary artery bypass graph, you got to template all that in. And it is complicated. That's why they want you to do electives here so they can show you a bit of everything. And when you apply for residency, they will look at, you do have experience here. All right. We don't have to teach you everything that goes on. It's a bonus point. Yes, we will get back to the electives. A very good question and LORs, but let's finish the step 1 exam. All right. There's a lot of questions that I want to talk about. Resources for step 1. What I used personally was Kaplan. Boards and Beyond did help me. All right. Let's write this down. Let me share all this with you people. It's kind of, let's see. I'm gonna try to pull this up and try to see how I can, okay. I'm sorry, I've been talking a lot and not writing enough down. I know you guys wanna see this. All right. Let's give me a second here. Let me share this screen. All right. Number 1, right? What do we have? I don't know why internet's slow. Boards. Actually, number 1 should be what? First aid. All right. Know that first aid in and out. Number 2. Let's move this right here. Number 2, whatever major resources that you need to do, Kaplan is very great. You don't need to watch the lecture. You don't need to buy the, the whole package or everything, but they do help. I would not recommend the books of Kaplan. They did not help me at all. That's why I use Boards and Beyond. But Kaplan lectures, video lectures with the professors are amazing. All right. Everyone has a preference. This was mine. I'm telling you my experience. Boards and Beyond. Video lectures and what do you call it? Book is helpful too, honestly. But if you use the video lectures with first aid and you highlight all the materials and you write your notes, I want to see your first aid filled with stuff. It better be like mine. I have a lot of highlighted notes with a lot of sticky notes and a lot of papers hanging out now because it's an old book. But anyways, these are your first 3 things, right? These are extras, what I'm about to mention, but they did help me. All right. Why did they help me? Because for me, I'm more of a visual learner, right? So what helped me? Sketchy. I'm not talking about the sketchy flashcards. I'm talking about the flashcards and the videos. They are just amazing. They are like 3 minutes long and maybe like 5 minutes long, right? You guys watch cartoons, you guys watch Netflix or whatever, right? You can spend some time for a 5-minute video. And when you start watching them, they're like mini cartoons, right? I love the story that they were getting into, and that helped me remember a lot of things, a lot of recall, right? Another thing I loved was Pixorize. I think I'm spelling that right. Pixorize is the same thing, but I would use Pixorize as when I was having lunch, when I was having breakfast, when it was my eating time, I would just put on a short clip, and Pixorize would also have such amazing stories. But the most importantly for it was like, I think it was pharmacology that I learned from Pixorize, and also microbiology was good as well. And there are so many, and you could easily, you don't have to, this is off topic, this is between us, by the way, even though we're public, but you don't have to buy the subscription packages for it. Online, there's a lot of PDF versions, there's a lot of videos that you can download from it. And yeah, that's it. And basically you don't have to spend that much money. You're going to spend money along the way. So why spend it all the way, on there? Yeah, that's another thing. Um, Pathoma. If you're in medical school, you should have your pathoma known by now. You should know it in and out, especially if you're in final year, fourth year, getting some used to, but still, pathoma has been repeated throughout your years, and pathoma videos are even amazing. Dr. Hassan Sattar has gotten me through some tough times. It was me and him on a date, and yeah, we rolled through it a lot. And pathoma is one of those things where you need to have it. In the morning, what I would do is I would used to get up in the morning. I'll also tell you what my schedule was when I was in my step one studying phase. Um, Pathoma was something that I would just, find a time, an hour, and just watch that one video. And you can spread it out. If you're taking a month and 6 minutes, 6 months in advance, then you could spread it out. You could watch a 20-minute clip and just understanding it, having it like make sure like, okay, you're writing things down, but also make sure when you're writing it, you're also listening. Because I know a lot of people make this mistake where they're just too much into writing and catching up. That does not work at all. Understand what he's saying, listen to what he's saying, pull up the visuals, all right? And pathoma would be something like, okay, if it'd be in my head, and then throughout the day I would be, either learning more about it in boards and beyond, or I would go in the first aid and learn about it, and all these things would correlate. You guys are gonna hate me for this, but one thing I am gonna say is that your studying phase is probably gonna be the most enjoyable moment of your life. I know. It is gonna be the most enjoyable moment of your life, because after you're done with studying, that's when everything just gets busy, you get all occupied, stuff happens. Enjoy the phase, enjoy the ride, taking your step one, step two. Obviously you won't enjoy it during that time frame, but trust me, you will. Maybe after you take the exams, maybe when you become a doctor, you're going to listen to this and you're going to think, oh, this guy on the computer screen, he was right about something for once. All right. These were the major things I did use. Let me think of. So a lot of people have questions on BRS. All right. At my time, yes, BRS board review series was good. All right. It had a lot of great things, but now that it's step one, pass and failed, I wouldn't need it. I wouldn't recommend it. It's just you're wasting too much time. You could be studying for step two after that. All right. Just but if you want to have those hard books, then those long books, then yeah, BRS, go for it. Again, these are some things that I used, but a lot of people are different, they help different. Anki, I was getting to that. Flashcards. I did use Anki for a short time, but it did not work for me. Anki, I thought it was too much, but yeah, doing those note cards, like 5 a day, maybe 10 a day along with it. It depends on your time frame, right? So if you have the time, do Anki. It's another thing that's just gonna, help you understand the concept. Again, make sure you're not memorizing, make sure you're understanding, because the USMLE exam it's not designed for us to memorize concepts. It's designed specifically for us to understand and apply those concepts in the questions they give us. Because what are those questions? They're regular questions. They will ask you about a patient coming in, he has so and so, what does he have, and then they will tell you the diagnosis, and then they will list, okay, he's taking this drug, what is the pharmacodynamics about this drug, that's all it is. And they will use it as like your doctor. By the time you're done with UWorld and step 1 and step 2, think of it this way: you are already a doctor. You have probably seen more than 1,000 patients in your life just by answering those questions. Think about it. Those are real cases. They're just designed in a way to make us, think about it more internally. That's why no question will come up as the same, right? So besides Anki, what else do I recommend? Obviously, UWorld, right? The next thing is these are extras, but I know some people do like them. And there's a lot of things now, right? There's AMBOs, there's osmosis, there's a lot of questionnaires with a lot of different companies, and I give kudos to them for coming up with it. And yeah, it's amazing what they're doing. But if step 1 is pass or fail, you don't really need it, right? If AMBOS helps you more, then why are you wasting time with, like, let's say, these, you don't need to do boards and beyond then if you're doing AMBOS and osmosis, right? But if these help you, and if you have the time to fit this in, then yeah, go for it. Put it all in, all right? How do I retain all this information? In the beginning, I was not a studious learner, but once you, like I keep repeating this, once you understand a concept, once you say so, once you get a grasp of it, then you'll start retaining, right? Because it is a lot of stuff to remember, especially when you get into anatomy, when you get into pathology. It is a lot of stuff to remember. But think about it, they're correlating one-on-one, all right? They will correlate, interlink with one thing. And like I said, redundancy, right? Once these things come up and more, it's going to click in your head and you won't even expect it. When I was taking the step 1 exam, a lot of questions came up where I thought, oh, I'm going to trip on this one, but I didn't know I had it in me, and it would like click in my head, and then I would get that answer right. And by the time I walked out, I knew how many questions I got right and how many questions I was iffy. So I had like a basic line score, which goes up and down, but I had an idea. And that's why diagnostic exam is important before you even approach the step 1 exam. All right. Besides UWorld, once you've gone to that phase where your exam is coming near, do UWorld more often, but also take those 8 hours practice exams. Where can you find those 8 hours practice exam? Kaplan has it. UWorld has self-assessment exams, which are like 4 hours each, but they're still worth it, right? If you search up online, there are other practice. I think Past Test has a self-assessment exam as well for this. I'm not sure about the spelling, but yeah. But NBME, take NBME as soon as your exam dates come closer, because some of those exam questions, you might be surprised, they do get updated. Some of those might come during your exam as well, or like a correlation of it. You'll get the basic idea of it, right? None of my questions were exactly the same, but they are similar though. First aid cases are good, right? And first aid cases will help you in the long run as well. But UWorld, use it as a priority and then do first aid cases. Again, these are all extra stuff. If you have the time, then it's good for you, but I would not waste so much time on step 1 now that it's pass or fail. All right. Which subjects have more weightage in the exam than others? At that time, I think pathology felt, and I actually have something from my previous, let me share that. Let me bring this up. Actually, that's a very good question. If I can find my previous slideshow that I made for you guys, I think last year, but it had the same thing. I know pathoma does has a lot. All right. Do definitely know your pathology in and out, right? But most of these questions change. When you're taking the exam, a lot of these questions will be like, oh, what are you actually throwing at, right? All right. So I can't find it, which is weird. Um, Honestly though, if you go onto the USMLE website, you can search it up, usmle.org. It has all the content outlines updated. So you can always go on that and you can check about it. They did change their website. So you could go on that and just check on what it is. Let's talk about the actual exam, right? How much time does it take to fully prepare for step one? It takes, I would say, honestly, if you're starting from all over again, 3 to 6 months is more than enough to take it. Even 3 months, I feel like if you know your basic science, you can take it in 3 months. Otherwise, 6 months is a good amount of time if you can take it during that time. But again, do not take it until you are prepared. No one, a lot of students I've had in the past, they've always had their exam date like near, but no one has been prepared. And I'm always like, no one is 100% prepared. But if you're getting a baseline score of, let's say, 240, maybe 230, take it. Why are you wasting more time? Take the exam, all right? Everyone's gonna be nervous on it. This is an interesting question. What do I recommend, USMLE, PLAB, or Middle Eastern exams? Obviously, I have not taken a Middle Eastern exam or PLAB. I've only taken the USMLE exam, but a lot of people are going through the UK route, and it is very interesting to me, but the UK route is something of a different. We did a session on that with Doc Ali. You can find that in our at Excemy Medical in one of our videos. But the whole thing is that lab exams they have been found to be easier, as I've been told, than the USMLE. So a lot of people do take the PLAB exam, but but it's the same amount of curriculum, right? If you're studying for the USMLE, the curriculum is the same as you're gonna study for the PLAB exam. I don't think one is easier or difficult than the other. Maybe getting residency is more easier in the UK than the US. It has been in the past. I don't know if it will be more difficult now in the future because no one can really tell the future. But in my personal experience, USMLE does open a lot of doors for you. But it also depends where you want to be situated. You know, there is no right or the other. If you have I had family in the States. That's why I chose the USMLE exam. Simple. A lot of people have family in the UK, and that's why they take the PLAB exam. Some people have, but if you're looking at income and everything, you can compare those. You can see which one is easier to get residency. I would personally think it's a bit more difficult to get residency in the US that I've experienced, but it is what it is. And in PLAB, they do have, I think in PLAB, it just takes way longer to get citizenship, though. That's how it is. I'm gonna give me a second here. There's background noise. Okay. Would recommend everyone mute their mics if they're here. Let's see. All right, that's fine. Okay. Is having a blue passport favorable when it comes to getting matched? Interesting stuff. So the thing is, though, you get categorized into two things. You get categorized into an IMG, which if you're from Pakistan, but if you have a blue passport, you get categorized into US IMG. Each have its own different seats, right? Again, if you're a US IMG, it's a little bit maybe a bonus because all these residents want you to be here. but it doesn't make a difference to them. If you're really good, if you have a high step 2 score exam, if you have researches in, if you've had elective and experience in, and you're coming into the States, they will supply you the visa and everything because they want to make their institute the best, you know? They want to get high on there. Obviously, they're not going to hire, like, let's say you have a higher score than I do, and obviously I have a lower score than you, right? So they're gonna look at everything, they're gonna look, but they're gonna take you because even though I have that US citizenship, you seem like a better category, right? Imagine if you're in like an interviewee's seat, who are you gonna take, right? What's gonna be more easy for you? So it's not a blockade, right? It's never a blockade for that. Don't get your hopes down. I've seen people, this is a personal story. I've seen people that have gotten residency after years of applying, right? They've applied every year, they've gotten after years, but they do eventually get it. But the thing is, are you motivated enough to go through that? And if you made it this far, you are basically halfway on becoming a doctor. Why not go all the way? Get it done, right? And I am going to revisit the 2024 policy. Let's look at that together, actually. But let me finish the step one real quick. We've noted down the basic sciences. Yes, pathology was number one on weightage of exams. Again, you can go on usmle.org for that, right? And now let's look at the most recent thing because they have changed it a lot, right? What I want to do is give you guys more of the way it comes out, right? After you've taken the exam, it is the most amazing relief experience you'll ever get. Obviously, results come out after 4 weeks, right? 3 to 4 weeks depends. Sometimes it can be delayed, but it does come out in that time frame. Um, and once that is there, then it will be automatically updated in your ECFMG. You'll have a USMLE transcript, which you can print out later. I think it's like a certain time where you can print it out. And then after that, if it's been more than a year, then you have to pay to get your transcript out, which is ridiculous in my opinion. But back to the 2024 now thing. If I've answered everyone's questions about the step one, because I do want to keep moving. I know we have short time, but I don't want to take all of it. Let me just give you the exam information about the step one exam. It is around 280 questions, I believe, right? But it can differ, right? Some can be less and higher. The way I differ is that they do throw you in some ghost questions, and these questions are just like normal, and it's okay if you get it wrong. It's okay if you get it right. They don't really count towards your score. Yeah, I did not know that until I was actually sitting down to take the exam. So what does it have? The step one is 7 blocks. 1 block is your break time. You get to decide how you want to divide the exam break time, right? I would see like maybe after like 2 blocks, I would take a 10-minute break because I have to divide that hour, right? And it's up to me how to divide that hour. 10 minutes break, then 2 blocks, 10 ever, and then I'd save the most time when I was down to my final blocks, you know, because you get that once you start, don't be discouraged about if you're getting like questions wrong or stuff because they do get better in the air. After that, ooh, actually, the most common question, can anyone guess what it is on the step one exam? You're gonna actually favor me for this one. The most common questions that they will ask you is about the changes in your venous oxygen saturation level, cardiac output, urine flow rate, systemic peripheral vascular resistance. These 4 things they will ask you, they will give you a big scenario, right? And then when you have that scenario, they're going to ask you which one is increased, decreased, increased, no change. And they give you a bunch of arrows on an option, right? That is the most common and asked questions that I've seen throughout your world. And luckily this old slideshow actually reminded me of that, which is weird. All right. So now that I've told you the questions, how many questions? So I could write it down here. The most common question in the step 1 exam, again, is they will give you a big scenario, right? And on the bottom, it will be like a chart, right? And they will write, what is your systemic vascular oxygen saturation level, right? And then beside it, it will be peripheral vascular resistance, cardiac output, right? And a fourth thing that I'm forgetting. But besides that, underneath it, they'll have increase, decrease, no change. And so you will have to find the right arrow relating to that question that they give you. It's gonna pop up. If I can find it, I'll pull that up for you guys. It's a very interesting question, right? Let me actually see if I have it in my old notes. Okay, actually, let me search that up for you and pull that over here if I can, because I've always found it very interesting, but again, it most commonly comes up on your step 1 exam. Okay, let's see here. I'm getting it's not coming. All right. Oh, you can't see my screen. All right, let me go over here and see it. Oh. All right, let me pull this up. I share screen. It should be showing up. I don't know why it's not. Okay. Can everyone see it right now? All right. Let me just paste this picture if I can. Oh, it's not coming up. Okay. That is weird. I lost it yet. Let me actually Google this in, and because I want to find this specific question for you guys, so the next time you see it, here it goes. Yeah, it has been a UWorld question. That is exactly right. I don't know if you guys can. Why is it? Okay. All right. So this, I just Googled up, by the way, but this is what I was talking about, right? The venous oxygen saturation level, they give you a whole paragraph. This comes in like so many times on the exam. They give you a peripheral vascular resistance, cardiac output, urine flow rate. I think if you're in doubt, they have given you something similar like this before, but these are the arrows I was talking about. Then you have to select the next one, which is increasing, decreasing, and no change, right? So these are the type of questions that do come up on the exam. Like I said, most of these questions will be in paragraph form. It will be like you're actually seeing the patient, right? They give you some sort of description, but the question on the step 1 exam will be basic, right? It will go in depth into it to see if you actually understand the concept, right? All right, so I have a question for you guys. How many questions are in the step 1 exam for the people that are taking it? And in block, how many questions are there? Okay, it's 280 questions, I believe, and it's 40 questions each, right? In a 7 blocks. Yes, 40 questions per block. So it is important to time how many questions you can do, because you have 1 hour per block, right? So you have enough time to do those 40 questions. If you know the answer to them and if you can solve them, because none of these questions are going to ask you to solve anything. It's just going to have you think about it, right? All right, let's move on to the 2024 policy that I want to share with you guys. All right. And let's revise it. Like I said before, the step one is basically coming in. That was not gonna happen because they haven't really updated on the website, but I want to actually show you the 2024 program that a university is doing so you guys can have better knowledge on what to do. So like I said before, the key changes of the USMLE exam, right? Let me bring this up. I don't know why it keeps, this is gonna bother me. Are you guys bored or are you guys learning something? I hope you're learning something out of this today. All right, let's talk about this, right? So what it was, 2024 policy, right? They were only talking about medical schools being accredited by agencies, right? What kind of agencies? I'm talking about ECFMG, right? That are recognized by WFME. WFME is the World Federation for Medical Education. What that really is that basically you don't, a lot in the past, even universities in Pakistan, they were accredited, right, with ECFMG, World Federation of Medical Education, because if they were not, then you cannot get an ECFMG certification. And that is important when you apply for residency. If you do not have that, then your school is not recognized, then you cannot take the step 1 or step 2 exam, right? You cannot take the USMLE at all. So it is important to follow up with your university of what their status is, especially if it's in a third world country, because if this is the policy that they're coming in with, that if they are not accredited, they will remove that university from the World Federation of Medical Education, and then you will not be able to take the step exams, because the first thing when you apply for taking the step exam is that they ask you, like they will ask you to, that before you take the step 1 exam, you have to fill out these credentials, these criterias. And when you go in the form that I was talking about in ECFMG, when you get your documentations from the university, you can't get it yourself. You have to send a link from that portal to the university and they will request it, and the university has to upload it to the ECFMG portal. You have no hands on it, right? So if they're not accredited and they can't send something back, then you're not able to take the exam. And that's where where this will be more forced into 2024. And that's where people are falling behind on it, right? Which other countries? I'm not sure I understand that question, Mona. Could you rephrase that question and I'll get back to it? Now, there are total of 6 pathways for residency in the United States there, right? Pathway 1 is for people already that are currently licensed in another country to practice medicine, right? If any of the first 3 pathways applies, then you can apply to take this, right? These are pathways, these are important pathways that I'm applying. I'm gonna write this down right here, right? Pathways for IMGs applying for residency. Let's get that done with, right? The first pathway that you have is that physicians licensed in other countries. 2. And a lot of these are tricky, and you will understand why they are tricky when you go down, when I go down a bit and explain the other 3 for you. 2 is people who have passed a clinical skills exam for medical license. Right? What does that mean? If someone has taken a clinical skills exam, even Pakistan has one, every country has one, then they can go for this pathway to apply residency. But there's a tip, there's a trick in all of these, right? And 3 to, let's say, all these 5 are for people who are for people that have their medical schools accredited. Right? And why that is, like I said before, right? These are specifics now. Their schools are accredited, but 3 explains that they have to be accredited, like I said before, by USMLE. 4 states that it has to be accredited by, this is something brand new, even I don't know it really, but it's accredited by an agency, which you have to look up in your own country, because I have not looked up this in Pakistan, but maybe a resident over there will explain this to you. By an agency that is with the NCFMEA, National Foreign Committee Medical Education Association. Yes, they have names like that. Let's bring this smaller so I can write down the 5th one. And what is the 5th one? It's for people who these are different pathways. See, none of it's a dead end. People who the medical school have issued a degree that is with a US medical school accredited liaison. Mostly talks about Caribbeans. Or China, actually. China have surprisingly surprised me over the past few months that Pakistani students go to China and they actually get their degrees and then apply for STEP exams. And it's an easy pathway for them, actually. But it's a lot of work because they do 5 years of medical school there and then 1 year of, I think, internship, which is like the same as house job. And the last pathway is for people who don't meet the requirement of 1 to 5 or have failed step 2 CS before it was canceled. Then they can apply again. But why mean that, right? So does any of this make sense? These are just different pathways. You can look it up on the ECFMG website. They have it listed down there, but this is just a summary for it, right? Is it necessary to take step 1 before 2024 or just get registered? I would say get registered right? But they would require, you have nothing to worry about if your medical school is accredited, right? But I would say get registered, right? And then if you can, take it before 2024. If not, then it's not the end of the world. You can take it after. All right. I know it sounds like a double meaning type thing, but to this question, there are so many answers, and I don't want to give you guys the wrong information. I will give you guys the information I have on me. And the best way that I think about it, if I was in your position, is that I would register for it and I would try to take it before any changes happen, because after the changes, you don't know what else they might throw at you, right? Yeah, PMDC is registered by World Foreign Medical Education that I know of so far. So it's actually great. If they are registered by WFME, that means everyone in Pakistan is safe, right? So they will be accepted starting 2024. So the thing is, though, the ideally one thing is that if they are not accredited, so starting in 2024, let me make this clear. Only medical schools accredited by agency recognized by World WFME will be accepted, right? But applicants that are not, and from some medical schools that are not, may no longer be eligible for ECFMG certification. That's why people are worried. That's why you guys have so many questions, because if they're not accredited, then you cannot get the US ECFMG certification, and then you cannot get residency here or even apply for step exams, right? I do have more information about this, which is how many countries are recognized about it, but you can again find that online, right? I don't want to spend too much time on this. It is brand new, but you just have to apply, right? Go to the ECFMG website, get your USMLE ECFMG identification number, right? They email you to create an account, apply for the certification once you've taken the exams, but you still have to fill out form 186, I believe. It is that. Then you pay the fees for the exam, and that's it. By the time you get that, once you pay the fees, once you've taken your step 1 and step 2, then you get your ECFMG certification. That's an interesting question. So the thing is, if the person has given step 1 before 2024 and the university doesn't get accredited, then they will be able to do, I believe they will be able to do. Actually, they can't. The thing about that is step 2 CK is a clinical exam skill for medical licensure. But what you can do is you can go through a pathway 1 or 2 where you are licensed in another country to practice medicine. Then you can still apply. Or you have given your standardized clinical skills exam in your own country, then you can still apply and give step 2 after that. So there are different pathways. It's not a dead end. They have figured out a solution to all of this, right? And I doubt schools that are not accredited, they will give you a year in advance to notify you, maybe 2 years, because even the USMLE or the National Board Medical Education, the whatever the NBME board, whatever it is, they will anytime any changes happen, they do give you 2 years in advance before it happens. So you will be notified beforehand. All right. So I think that covers all for the 2024. I hope that was helpful, right? We are past the 1 hour, so I will be going for more questions. Make sure it is great if you guys repeat your questions at the end later on, because I'm trying to get through every single one. But the thing is that there's questions on Facebook, there's questions here on Zoom, there's questions, everywhere. So I'm trying to answer all of them. All right, real quick. I know you guys want to know more about the step 1 exam. I think I've covered all that I can. Step 2 CK. Oh, I would recommend just focus more on that. Clinical knowledge is important, especially now they will be looking at that score. Before you take any exam, a word of advice, write down your score, right? Write down your target score. Make sure that I want to say, let's say I want to score a 260, right? I'm going to make sure I'm going to write it down on a sticky note. I'm going to make sure I'm going to write it down on a piece of paper or like, on my wall. Parents won't be happy about that, but still in the mirror, wherever it is where you just get up and you see it and you say, that's my motivation for today. That's the score I want, right? And I don't want anything underneath it. It will happen. I've seen people. Just have the proper motivation and you will get through it, right? Yeah, I don't think OET covers step 2 CS, but you have to take the OET now for international medical graduates. That is all listed on their website as well. But yes, that is a pathway. OET is important. OET or IELTS, same thing. But again, if you want to get past that, IELTS or OET, I would recommend go online, go through as many practice exams as you can. All right. If you guys are interested, I can bring a guest later on that can go more in depth about this and that has gone through this recently. So he can share more about the OET and IELTS exam as well. And we can do a separate session about that. You guys are what motivates me to come on air. That's all this is. All right. What mistakes did you that you wouldn't prefer us not to? Oh, what mistakes I made. Oh, tell you guys all my secrets. Wow. I made a lot of mistakes that I didn't know. I didn't have proper guidance. I was doing it by myself. A lot of people I asked didn't really help. So I had to figure things out a lot by myself. One of those things that I did is I was too worried about taking the step exams and doing research and electives all at once that it was not worth it to, spread myself out right that. What I would do is if you're taking the step exams, focus on the step exams, all right? If you're in medical school and you're taking the step exams or you're studying for it, your studying phase has begun, 5 hours a day is good enough. 5 hours studying time. If you can't afford it, maybe 4 hours studying time, right? There's always a correspondence because whatever you learn in your medical university, it's the same material you're learning here, but more in depth in the step exam. So you can correlate it. Let's say I'm learning cardiology, right? In Dow or, KMDC, whatever. And then I can use that and to learn it while I'm taking my step study, right? I'm going to learn the basics for that. And I'm in 4th year. That basic is going to help me with my clinical for cardiology, right? So that was one mistake. The other mistake I would do is, other mistake I made was, so at the bat, I was so deranged. I did not know where to start, what to do. I will even give you guys my study schedule. It was pretty crazy back over there. But at that time, what I did was I just jumped right in, right? I did not take the diagnostic exam. I jumped right in. I didn't know what my angle was. I didn't know where I was going. But throughout the middle, then I restarted myself and, I covered all my bases. And when I started talking to like my group session buddies and what they're doing and corresponding with, and that's how I was able to get, the score I did get. So get that diagnostic exam, right? Take it. Make sure you're answering questions on a daily basis. It could be 10 questions a day, 5 questions a day, 20 questions a day, whatever you're comfortable, but make sure you're getting it. Even if you're getting it wrong, it's okay. All right. It's your first time. It's okay to get it wrong. All right. Don't make it discourage you or anything like that. And yeah, these were the common mistakes I made when I was studying for the step exams. And another thing is I always tell my students this, I always tell them this, is that in your studying phase, you are gonna get depressed. You are gonna be like there. Make sure, and there's gonna be a time where you are gonna be like, oh, I've studied enough. I gotta close the book. I gotta do something. Take that break. All right. I used to take one day out of the week just to myself, just to refresh, right? I would close the books. I would not open the book that day. I would just, maybe do like 10 questions in the morning, get it out of the way, and then it'd be just me time, right? Because your brain needs to reset, all right? You cannot, you cannot go through like constantly studying and constantly sitting on your desk and reading about materials. It doesn't work like that. So make sure you take that once a week break, right? Mine used to be on a Sunday. So Sunday was just to myself, but I would like constantly think about like, questions or materials or what did I learn over the week. Um, and that was it, and then I'd go outside, play basketball or just, video games or something to get my mind off of it. So make sure you're getting that. It is. FIFA season is here, so it's very difficult. Hard to keep up with all the games. But you have to do what you have to do, right? Making connections with established doctors through research will help us through the match process. Is it true? Yes. Okay. Fun fact. Connections is important, but it's not everything. So it does help you get into the university hospital that you will be applying to, because they'll be like, oh, he used to work for me, he's such a great student, or she used to work for me, she's hardworking, and she has this medical knowledge and she deserves this position, so they will stand up for you, right? So it does count, but it's not everything. If you can't establish connections nowadays, it's not that hard. LinkedIn is an amazing resource to use. All right, LinkedIn is amazing to establish with doctors. Go on university's website, right? University website and find it, right? Go, they have their number, they have their email address. Just email them. And if you can't, call them. See what happens. What's the worst thing that can happen? Just reject you? That's it. That's all there is, right? Yes, Mona, Mispa, I will go through the step 1 outline again for everyone to hear. And can they still give the step 2? Okay, I've already answered that one. So ideally one should be done before step. Okay, so let me just walk you through my ideal schedule that I did when I was a student, right? So the ideal schedule that I did is I woke up, right? And my schedule was crazy. I used to wake up at 6 a.m. in the morning, and this was when I didn't have anything. This was like my, what do you call it? The rapid phase of studying. This was more of when I had like 3 months remaining till my USMLE exam. So I'd get up, I'd have breakfast. Along with my breakfast, I would watch Pathoma. All right. And with Pathoma, then what would happen is throughout the day, I would then go on my read my first aid shortly, right? I would have Kaplan, right? Kaplan videos. It was a Kaplan course for me. So I was with a professor. I had a certain time to get that lecture. After I was done with that, then I would do when it was lunchtime, I would do no, sorry. After Pathoma, I would do UWorld, right? So Pathoma, watch the videos. UWorld did 10, 15 questions, whatever I was comfortable with. 10, 15 questions. Then I would go over, Kaplan would be there, but first aid first, and then Kaplan. Then I'd have a lunchtime. It would be my break. During lunchtime, I would watch a sketchy video or a pixelized video just to get it in my head. And after that, then I would go in the boards and beyond. I would use boards and beyond as like a review resource, right? Because I would be reading first aid in the morning, then I would review that with boards and beyond in the afternoon, right? After I was done with that, then I would take, after boards and beyond, I would mostly go over any other books that I had. I was reading one in microbiology, which was I'm pretty sure you guys have heard of it. It was more like I forgot the name. It's like Dummies for Microbiology, something like that. And it was such a fascinating book to me because it had so many like pictures and everything. But yeah, after that, then I'd review over the flashcards of like Anki, if I could. This was in the beginning, Anki in the end. Because what would happen is I would utilize all my study time in the morning, and then when it come for, yeah, Dummies for Biochemistry, it's really good. And then once I was done studying, I would review in the afternoons and use it as a resources, Make sure whatever you're learning, you review it at the end of the day, you know? Because even with Pathoma, after I was done watching the video, then I would review the notes I written down and go over it with the book. When it came to dinner time, things would end. I would have in maybe an hour of break in between to just calm myself, to relax. By dinner time, I would put up another Pixarize. I was in it, you know, and I would be then solving more questions, and I would specifically sleep around, I think it would be 9 p.m., right? So I would make sure I would be early I would wake up early in the morning to have most of my stuff, not even 6 a.m. I'd sometimes get up at 5 a.m. and start studying, which was crazy, which is not for everyone. But if I slept early, that means, it gave my brain more time for retention. So after 9 p.m., I was out, and then I'd wake up back again, same daily routine, right? But when it came closer to the end, I would make sure that I was utilizing my Sundays on taking a full practice exam. So what would happen is that in the middle, I would write it down on my calendar. Whatever you're doing, make a calendar for yourself, right? Make a calendar on, if you're reading from a book, this is how many pages I can do in a day. And this is how I'm going to cut it off during the day. Like, let's say you have 500 pages in a book and you just try to cut off like how many can you be reasonable with yourself, how many can you do and understand the concept in a day from that book, right? So then that's how you would make your schedule. I'd also write down my timings. So let's say like 6 a.m. to this slot is filled. It'd be more like an Excel sheet. I wish I had everything so I could show you guys. It probably is, but it's probably in my old hard drive, which I would love to share that with you guys next time as well. But I would make slots. So like 6 a.m. to blah, blah, have this in there, 8 a.m. to da, da, have this in there. And just like I would write the page numbers. This is the page number to this page number that I need to finish throughout the day. Anki would always be at the end of the day. And then I would end it by also answering a few questions. And that's it. In the middle of the day, like on a Wednesday, I would make sure that I just use that time to just do an NDME exam or a full-length practice exam, and that would go out throughout the day. And that just day, I would just take the 8-hour exam and just, that's it. 8-hour exam, and then I just use the rest of the day to just like be free, calm myself down, and start again next morning. Everyone's different. That's how I made my schedule throughout the day, and that's how I got through it. It's not easy, it's tough, but you all will get through it. All right, which diagnostic exam should be taken in the very beginning, in your opinion? Kaplan. Take the Kaplan one. It's not scored, it's more like it shows a percentage wise, but it's still very good. Take the Kaplan practice exam, or actually pass test is also good, right? I would save the U World self-assessment for later. But if you do search online, there might be even more out there now. But in my day, I had Kaplan or pass test. So one of those two were great. So I did talk about this earlier, but I will repeat it again. It is better to focus on researches during your honestly, you have so much time for research, even after medical school year when you're applying for residency. It's easy to get, but research is important nowadays more than ever. So if you find a research in your medical school year, go for it. But I would say keep step one as your priority, right? Because after you're done with step one, then you can just get a research, right? It's good for you, right? Yeah, that's it. Just researches are important, but steps are even more important, if that makes sense. You got to prioritize yourself, right? So if you're in medical school year, take that step one exam, and then, after that, you have enough time to do research, even, when you're studying for your step two CK, because research sometimes helps with step two CK, and so does rotations when studying for it. Even step three, if you're doing, hey, if you're done step one and step two, you want to take your step three, go for it. It's not a bad idea. It's an extra bonus point. Is a good idea to give step one in third year. Yeah, I mean, whatever I would start studying for step one in third year, but I would give it at like fourth year or at the end of fourth year, in my opinion, but everyone's different. In my opinion, I would give it at the end of fourth year and just start studying in third year for it, so you have enough preparation. And if you're prepared, get those 3 months, sign up and take it. And also make sure you have your documentations in from your university, because that does take a lot of time. So make sure that is first. So how to start preparation from scratch, like if I'm starting my preparation tomorrow, from which subject should I start and from which resource? Like I said, all the subjects are related, but this is the rundown of what I started with first. If you're starting preparation, take the diagnostic exam first, and then start with biochemistry, right? After biochemistry, do start with microbiology and then pathology. Or if you can do or if you can do biochemistry and pathology together, that's also great, because they correlate with each other and you will be surprised of how much. Anatomy, I would say towards the end. Genetics, it's easy stuff. You guys can get it right. It's only a small ethic questions do come up, but do read up on that. I know it's boring, but ethic questions will be there, right? So again, diagnostic exam. If you are starting your preparation tomorrow, take that diagnostic exam first. See where you are, see where you're not. Do take it, like in my opinion, biochemistry, get it out of the way, hit it first, then microbiology. If you can do biochemistry and pathology together, that's amazing, because they do correlate with each other. Anatomy, I would save it towards the end. Genetics is more, it's easy stuff, it's very short stuff. But genetics is mixed with aging, and they have other bunch of new stuff now. They're in the new edition of the step one book. But ethic questions now is more important than ever. They will ask you a lot of questions on that on the step one exam. So please do go over that. People miss it and they lose a lot of points because of it. So how to, yes, Hafsa reminded me. Thank you, Hafsa, because I have a lot of things going in my head. But UWorld, if you are starting preparation, I would say start UWorld from day one. Do at least 5 questions a day. Test yourself. All right, after you've taken your diagnostic exam, because you're not going to be studying, like, just do it in the morning. 5 questions a day in the morning, and then slowly increase yourself, right? Do it from the very start of your preparation, so by the end of it you will be ready. How to manage the budget if we apply for electives or observerships in US. Also, does the city matters? City does not matter where you do it from. All right, university hospital doesn't really matter. You're doing electives. In some, yeah, I mean, if you get into Harvard Medical, then yeah, people are gonna be like, oh, you did an elective in Harvard or John Hopkins. Oh, but it doesn't really matter when you apply for residency in the end. Just need the experience and just need to have. This is one thing that people do forget. Make sure if you're going to a university hospital, make sure it's not for nothing, because have an LOR returned from the doctor. All right. There's a whole system of LOR, which I will go in detail in another time. But the basic concept is most of these doctors would ask you to write the LOR. You write it for them, and all you would do is send it to them in a PDF document. And that doctor would then upload it into the ECFMG portal with the ID, the letter ECFMG letter ID that you provide to the doctor. He plugs in the letter ID and then he, puts in the letter for you. All right. You don't have to do anything. Just write the letter and then send it to him. And then there's a whole nother website which you can find on I think the AAMC once you registered for that. AAMC is another site that you guys need to be worried about when you this is later on when you're thinking about applying for residency, but after during step 2, and it does also when you're getting your letter of recommendation, so it's important. So LORs from relatives. I know if she can write that again, that would be great. But I could give you the general outline. Getting a letter from relatives in the US, if you do have a doctor that is a relative in the US, then yeah, if he can sign it, that's amazing. All right, that's bonus points, and people do that, so it's not a bad point. They won't, honestly, when they're going through your application, no one has the time to look through your letter of recommendation. All the letter of recommendations do look very similar to each other, and there is no single letter of recommendation that will just say anything bad about you. All right, so yeah, if any LOR from anywhere, from relatives, if there's a doctor's from any doctor, it counts. Make sure you have that in. And most university hospitals, they require at least 3 letter of recommendations. So keep that in mind. And make sure that LOR is related to the field that you want to apply for. If we do electives in Johns Hopkins, Saudi Arabia, would it LOR? Yeah, it would be accepted. Yeah, it would be amazing if you get an LOR from there. LOR from anywhere is great, right? You can get it from Pakistan. It's amazing. But make sure you do have a US experience when you're doing electives, at least one. So you can get, because doing rotations in Pakistan is very different than doing rotations here. The system is very different. Okay, how the whole HIPAA thing is very different here. So there's a lot of things that needs times to adjust. So make sure you have at least one rotation in the US. Yeah, you're right, Hafsa. Honestly, you don't need to, I would say start using these resources all together, but have it correlate with one subject. So if you're studying like cardiology, you can read cardio and first aid, you can check out pathoma, UWorld, BMB. So that way everything is just in one structured format, right? And then you set a time frame of how much I can cover it in, you know. So start doing, because you're not going to use the whole day to do first aid only. You're not going to use the whole day to do pathoma only, or B&B, or Kaplan. Divide those up. Think of them as different subjects, right? Think of these resources as different subjects, and think of them as you're going to class again, right? You have a first aid book, you have a pathoma, you have a B&B, so you're going to use all of them with the UWorld, and you will do great, and you guys will score high. Well, yeah, if you study well enough, then yes. Yeah, I've talked about this way beforehand, a year ago, and this question repeatedly comes up, which I don't mind repeating. Electives are given to medical students that are currently enrolled in medical school. Okay? That are currently enrolled in medical school, even if you're in final year. Observerships are electives, but they are mostly for students that have graduated medical school. Okay? Electives are for students that are in medical school, and observerships are for students that have graduated. electives, in my opinion, have been more you know, important because they look at students that they're doing it during their medical school, but it's okay if you do a rotation after you graduate, it will be counted as an observership, but if you can get an LOR for that, then it will still be counted as a bonus point, okay? None of this becomes a negative point towards you. I hope I was clear on that. What advice you would give to recent graduates during internship when starting step 1 prep? So, doing internship when starting step 1 prep, by the time you have just graduated, you probably have forgotten most of your basic sciences. Start from scratch, get on it. And internship is very good because you will be doing basic sciences with all the clinical stuff that you are doing currently, and that will correlate with each other. So it will be helping you actually, right? So I would say I've had someone ask me about this way beforehand. Actually, a very good friend of mine, and she took her step 1 after 2 years or so, but that was because of having a family and all that. But still, she took it, and I told her the same advice. Listen, there's never an end point, right? You could just make sure you have your step 1 and step 2 done, right? It is going to be hard to get a residency after a gap year of 2 years because residents look at, oh, what have you been doing for those 2 years? Maybe you're out of practice or something, right? Why would they hire? Like, if you guys were to hire me to do some task and I haven't done that thing for like 2-3 years, why would you bring me on board, right? It doesn't make sense. So it is hard, but it's not impossible. I've seen people that have gotten residency even after this. So there you go. All right. Anything about the step 1 exam that I can elaborate even more? I'm open to questions. I think I have shared it enough. I think I am still online here, and I hope I was a help to each and every one of you. And I am sorry if I missed your question. There are so many going on. So I have been getting these questions and I'm trying to you know, uh, answer a lot of you. All right. So if I have missed your question, I am very sorry about that. And if you still need, we are still live and I will be happy to repeat anything that you guys have for me. All right. This is what I love. All right. We have a question here. Can we get surgery in US easily? Surgery is competitive, my friend, but it's not impossible, right? For a surgery application, you need to have elective in surgery. You need to have some experience in surgery, have research that involves surgery, right? And besides that, you would also have a very competitive score because general surgery, again, is a 5-year surgical program. So it's not easy. Nothing is very easy, but it's not impossible. And I'm pretty sure if you get a high score and have research and electives, you can get it. You can get it. A lot of IMGs get prelim, but if you get prelim and then get, stay for another year, you can get categorical. Step 1 is useful if you're planning for residency in the US, but if you're going to the UK, by the way, I am sure that UK is planning, because UK has another whole step that I'm never worried about. If you are planning to go to the UK, I'm pretty sure you can stick your step exams and go to the UK now. I'm not very informative about that because I've never had any relations with the UK, but this is what I was told, and this is the information I'm passing out. So all these information that you've learned today, thank you for having me. All right. It's always great talking to you guys. It's always great informing. I hope I was a great, informative senior to you guys that I possibly could be. And Anytime I tell everyone this, even Dr. Mosen as well, that my doors are always open. I'm always ready to help. If you know me, call me. No worries. Send me a message on Instagram if you need any questions or help with anything. Um, b- After that, can we practice in Canada if we have given in USMLE? I have no idea, and I'm sorry, I really don't. I know people that have given. Actually, yes, I think that is a possibility because someone has taken step exams and they have gotten residency in Canada. So I think that is possible, but I am not sure again because I haven't done most of our done email on that. Can we get your email address? You can message me. If you go to my Instagram page, it does have an direct email link on that. So you can email me on that. I unfortunately do not give out my email to public, but again, doors are open. So that one is more of a professional email account. So if you go into my Instagram page, you'll find me under underscore Hamza Farouk. And you can directly click the email thing and I will receive an email on your behalf for that. All right. And now I think that is all for today. We can wait a few minutes for more questions. And Mariam, are you there?
Yes.
Okay, Mariam, I'm gonna hand it back to you. All right.
I want to thank you all on the behalf of Excemy Medical for attending the session. I hope it have been a beneficial session for you all. I want you all to check our Instagram, Facebook, as well as the YouTube to stay updated about the further content and the upcoming sessions.
All right, we have one more question here. Yes, please follow our Instagram page so I can be able to give you guys more information. Please follow our Facebook page as well at Excemy Medical. If you want to learn more about FX, I've done videos in the past about USMLE. And yeah, keep growing our community so we can help you further. One final advice before I answer this question is I tell everyone this, the information I share with you, it's only because I'm hoping and being grateful that you will be able to pass on this information to someone else that comes, before you that is in need of this, because in my year, I did not have, the proper help for it. Did most of the things by myself, but I do not want anyone to go through the hardships that I went to. So I'm hoping that whenever someone comes like this to you and you become the professor and you have your own students, then you're able to pass on this information later on. All right. Final thing, I'm just going to answer this last question. Can you please explain the documentation thing after registration? Yeah. All right. Actually, let me take you to a very helpful website that explains everything. Let me bring that up. And I hope you're talking about the ECFMG, right? It's very useful. It's very recommended. That is not it. uh, okay, yes. I always love this guy. Have you guys heard of IMG Prep? I think he's like Iranian or Syrian. A very nice guy, by the way. Amazing guy. All right, let me show you this one last time. All right. Hopefully you all can see this. So he's such an amazing guy, and I had a similar idea where I put this on my thing, but this we're skipping this, we're skipping this. All right. So what do? You go to ecfmg.org, right? Everything's .org. ecfmg.org, you will click on online services, right? Online services, you will click on use the interactive web application where it says obtain under for physicians, obtain a USMLE ECFMG identification number, complete the application for ECFMG certification and download your certification of identification form, form 186 for notarization. Notarization is nothing. It's just once you fill out the form, they schedule you an appointment and this person comes on camera. You have to turn your camera, they take a picture of you and they stamp your paper. Very easy and straightforward, but you have to pay for that, and which is ridiculous in my opinion. Apply for use, everything is written out here. So you can always use the Oasis system as well, but do not worry about that. We are going to use this. Right? Once you do that, it will come up with create an account and want to request one, right? You click here, right? You get these instructions right here. I'm not gonna do it, but you check these boxes and you click next. All right. Now back to the here. Here he has an old thing. That's why I showed you on the new website. This is the old program, right? But it's the same thing, online services, IWA, interactive line application, right? This comes in, like I showed you, you click at the bottom, right? And then you make an account, right? In the account, it does tell you that you have to, like I said before, it will ask you for $150 payment, right? But you make sure you write down your school name, you fill out your name, your date of birth, social security if you're living in the US. That's it. And then you complete and notarize the certificate. After you made your account, they will send you. Actually, this is very good. It reminds me of a question someone has. See, they updated it. Used to be 150, which I remember, and now it's $160. They updated it. And here, see, everything is listed on their website, ECFMG website, right? Even the fees someone else was asking earlier, the step one is on $985. Another question I usually also get is that you can take it internationally, but they do have their own charges for that. You can click on this website. Step two is you get $1,000 for this, $1,000 for that. By the time residency comes, you're applying to like maybe 200 university hospital, and that comes as a $5,000 bill. So the payment never stops. It never stops. And you can also check what they require before you get it, right? So this is for the 2024 that we were talking about earlier though, right? But this is only if you want to satisfy or complete the clinical skills requirement, which is important like it was before. That you have to complete an ECFMG pathway, the pathways I discussed with you earlier, or you have to do it with attaining a satisfactory score on the occupational English test medicine. So it doesn't matter what order you take the step one or OET, but you need to have this done, right? Step one, OET, and step two. If you don't have a step, because step two CS is suspended, so now they're just putting it on any clinical skills test or OET in the matter of fact, but you need to get all that done. Okay, back here. Nope. Where'd it go? Okay. So once you've made the account, right, then you can log in. They will email you your USMLE ECFMG ID number. They will email you a password for it. You will log in, right, and a window will open. And then that's when you need to complete this form that I was talking about. Certification form 183. What this is, it's an online form, right? And only your university can fill this out for you. That's why it's important to have a university fill you in on that, right? If they're accredited or not, because you will just supply them with the ID number, application ID, and then they will make sure like what was your expected graduate date, expected degree date, medical student status. They have to verify this, and then they will send it back onto the portal. After that is done, after you have done all these documentations, right? And these have never changed over the like the days. This was what I was talking about that takes so much time, is that you need a copy of your medical diploma if you haven't if you've graduated, or you need to at least have a transcript, right? Transcript is important and that does take time, so you need to talk to your medical institute about that. And then on the website, it will also list down any additional documents that you need, which is also on the Oasis. All right. Okay. After you've submitted your documents, then you can receive your scheduling permit. Then you can select the 3 months that you think that you're going to apply for, right? Well, in my days, I don't know if they changed it now, but in my days, you could select those 3 months before you sent the documentation in. So I would select like January, February, March, or whatever. And then I would get the documentations back. It'd all be received. And then I was able to give it. But those 3 dates aren't confirmed until the documentation comes back and until you give your payment, right? Because you can give your payment straight off the bat. It will ask you for the payment right then and there, right? And after you're done on that, then you go to Prometric. This is where I took all my licensing exams and it scared the hell out of me. Sorry for my language, but so Prometric, they do give you a practice exam, by the way, so you can get comfortable. So you can get comfortable with like, so you can get, they do give practice exams, but mostly it's the same exam that you get on the USMLE like website, but it's just so you can get comfortable with the environment, with the table setting, with like how you're taking the exam, the area around you. So they do give that for free here. But on the exam date that you've already paid for the exam, so you book for test takers, you schedule your exam, and it's going to list a lot of things. You guys are bringing back memory, and then you put like AMC on here mostly, or it just has USMLE. They've changed this too. I think it's USMLE now. Just yeah, United States Medical License Exam. You click on it and you book. You find a location near you, you schedule it, confirm it, and that's it. You're on your way to taking your step 1 exam. Hopefully that was helping you guys a lot. All right, session has been long enough. I think we should call it quits here. You guys might have been tired, but I hope I was able to help you all. It is a long process. There is so much to talk about. Eventually in the future, I do want to divide the courses so I can focus on one thing in one of these courses. And with your guys' support, I can bring more out of this. All right. That is all for me. I will leave it to Mariam to head us out. Thank you so much. And I will see you soon, inshallah. All right, Mariam, over to you.
I would just like to thank you all again on the behalf of Excemy Medical for attending the session and being patient with us. And I would like you all to check our Instagram, Facebook, and YouTube to stay connected with us and to stay informed about the upcoming sessions.